Guys, let's briefly look at the anatomy of the vagina. The vagina is a fibromuscular collapsible tube that extends from the vulva, that's the external genitalia, to the cervix of the uterus. It is part of the female reproductive tract. So this is the vulva, also known as the external female genitalia. The vagina begins from here and extends to the cervix of the uterus here. Forget about the cancer cell here. This is not what we are talking about. The picture is just for illustration. What's the location and orientation of the vagina? The vagina lies posterior to the bladder and urethra. This is the bladder here, and here is the urethra. You expect to see the vagina just posterior to the bladder and urethra. In other words, you can see the bladder and urethra are anterior to the vagina. The vagina also lies anterior to the rectum. You see the rectum right here. You see the vagina lying anterior to the rectum, or in other words, you can see the rectum lies posterior to the vagina. It's run in an upward and backward direction from the vestibule to the cervix. So this is the vestibule here, So the vagina runs upwards but does not go straight. It goes backwards towards this direction to the cervix here. Yeah. So what's the length and shape of the vagina? The average length is from 7 to 9 centimeter and is variable. It's actually longer in multiparous women. That's women who have given birth multiple times. Its shape is flattened anteroposteriorly, so it appears like an H-shaped slit in cross section. That's if you go through the cross section of the vagina, you should expect to see a H-shaped slit. Upper end surrounds the cervix, forming the vagina fornix. This is the upper end of the vagina, and it forms the fornix of the vagina anteriorly, posteriorly, and laterally. So you expect to see this fornix laterally, posteriorly somewhere around here, and anteriorly, that's forwards. So let's talk about the external opening of the vagina. It is called the vaginal orifice, and you can see it right here. This is what is referred to as the vaginal orifice. It opens into the vestibule between the labia minora. This whole place is what is referred to as the vestibule. This is the labia minora here, and this is the labia majora. May be partly covered by the hymen in virgins. So in virgins, you should expect to see a hymen around this area. Yeah. So let's talk about the walls of the vagina. The anterior wall is approximately 7.5 cm. So this is the anterior wall of the vagina, and you should expect to get a measurement of 7.5 centimeters if you take measurements. That's approximately. The posterior wall is 9 centimeters. Here is the posterior wall of the vagina. You can see it runs upwards and backwards, and it is longer because it begins from the vulva somewhere here and extends to the fornix somewhere here. Then it is made of thick distensible fibromuscular tissue with rugae. This is what is called rugae. These folds you see around here, though this is the anterior wall of the vagina, but in the posterior wall of the vagina, you expect to see such folds. They are known as the rugae. So the vagina has no true glands. Lubrication comes mainly from the cervical mucus and the vestibular glands, which is a topic we'll discuss some other time. So let's move to the blood supply. What are the arteries that supply the vagina? The vaginal artery, which is a branch of the internal iliac, the uterine artery, and the internal pudendal artery supply the vagina. So this is the internal iliac artery right here. which is giving rise to the vaginal arteries that supply the vagina. It also gives rise to the uterine artery, which is supplying the upper part of the vagina. These vaginal arteries supply the lower part of the vagina. So we look at the veins that drain the vagina. The vagina is drained via the vagina venous plexus through the internal iliac vein. So expect to see the internal iliac vein forming the vagina venous plexus here, which drains the vagina venous plexus here, actually coming from the internal iliac vein, yeah, which drains the vagina. So let's look at the innervation of the vagina. The upper three-quarter of the vagina is supplied by the autonomic nerves from uterovaginal plexus. They are actually insensitive to pain. You can see the uterovaginal plexus here arising from the terminal end of the spinal cord to supply the upper three-quarter of the vagina. The lower one-fourth of the vagina is supplied by the somatic pudendal nerve, which is sensitive to pain, touch, and temperature. You can see the somatic pudendal nerve arising from the sacral nerve S2 to S4 to supply the lower one-fourth of the vagina, which is sensitive to pain and temperature. So let's move to the lymphatic drainage of the vagina. The upper part is drained by the internal iliac lymph nodes. This is the upper part of the vagina. It is drained by the internal iliac lymph nodes. The lower part of the vagina is drained by the superficial inguinal lymph nodes. This is the lower part of the vagina, drained via the superficial inguinal lymph nodes. So let's look at how the vagina is related to other organs in the pelvic region. Anterior to the vagina, you should expect to see the bladder and urethra. This is the vagina here. You can see the bladder and the urethra anterior to it. Then posteriorly, you expect to see the rectouterine pouch of Douglas and the rectum. You can see the rectouterine pouch of Douglas here, and you can see the rectum, which they are both posterior to the vagina. Then laterally, you expect to see the pelvic fascia and the ureters. We don't have a good image right here to show us the relationship of the vagina laterally with the pelvic organs, but you should expect to see the pelvic fascia and the ureters laterally to the vagina. Thanks for listening.